Hello, everybody. Welcome and thank you for joining us for today's National Alzheimer's and Dementia Resource Center webinar, sponsored by the Administration for Community Living and hosted by the American Society on Aging. My name is Julia Burrows. I'm the program coordinator with the American Society on Aging, and we are so glad to have you join us today. We will be getting started in just a moment. The slides for today's presentation are available under the tab on your screen labeled Resources. Under the tab labeled CE Application Here, you will find information on how to obtain CE credit for today's event. You have 60 days to complete the continuing education application, and it may take up to 30 days for us to process and issue your request. If you have not logged in directly into this webinar using your own confirmed individualized URL, you will not be eligible for CE credit because we have no way of tracking your online attendance. If you would like to receive that CE credit, please be sure to register using your own email address and then using your own individualized URL. If you have any questions during today's presentation, you can send those to us at any time using the questions box, and we will save the last 10 to 15 minutes of today's program to get to those. And now I will turn it over to Sari Schumann of the National Alzheimer's and Dementia Resource Center.
Thank you so much, and thank you everyone for joining us today for the National Alzheimer's and Dementia Resource Center webinar, Supporting People with Dementia Where They Live, Dementia Education for Building Management, a Chicago Model. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Before we start the presentations, Erin Long of the Administration for Community Living will provide us with a brief welcome. Erin?
Hi, everyone. I want to thank you for taking time out of your busy schedules to join us today to learn about a program that ACL has funded in the city of Chicago through our Alzheimer's Disease Programs Initiative grant program. I want to thank Victoria Russo and Valerie Gress for sharing their wisdom with us today, and look forward to their presentations. And with that, I'll send it back to you, Sari.
Thank you so much. As you heard, today's presenters are Dr. Victoria Russo and Dr. Valerie Gress. Victoria Russo is the Project Director for the Alzheimer's Disease Programs Initiative grant in Chicago and Supervisor for Outreach to Isolated Older Adults with the City of Chicago Department of Family and Support Services Senior Division. She received her doctorate in sociology with an emphasis in life course and aging from Loyola University of Chicago and a master's degree in gerontological studies from Miami University in Ohio. Valerie Gress is a researcher, practicing geriatrician, and educator whose innovative research solutions have created new models of care, workforce training programs, and copyrighted M technology to address the needs of older adults. She is co-director of Engage Illinois, a cluster of programs intended to enhance geriatric care, build age-friendly health systems, and establish dementia-friendly communities powered by millions of dollars in grants from the U.S. Human Resources and Services Administration. At this time, I will turn the floor over to Victoria Russo to start the presentation.
Thank you, Sari. The Chicago Department of Family and Support Services Senior Service Division is the area agency on aging for the city of Chicago. I was asked to cover the background on our dementia-friendly buildings training, the partnerships we've made, and the next steps moving forward. My colleague, Dr. Valerie Gress, will present the specifics of the curriculum and content of the training program. Chicago Department of Family and Support Services efforts on this grant are supported by the Administration for Community Living under a 3-year Alzheimer's Disease Program Initiative grant. How did this project originate? In 2012, DFSS formed the Age-Friendly Chicago Commission in response to a World Health Organization initiative called the Age-Friendly City. The commission consisted of representatives from community organizations around Chicago and was tasked with measuring older residents' satisfaction with 8 aspects of an age-friendly city: civic engagement and employment, communication and information, community support and health services, housing, outdoor space, respect and inclusion, social participation, and transportation. What did the Age-Friendly Chicago Commission learn? Working with DFSS, the Buehler Center for Health Policy and Economics at Northwestern University, conducted a total of 8 focus groups with older adults at each of the city's 6 regional senior centers, as well as 1 focus group with the DFSS advisory group. We asked older Chicagoans to tell us about the 8 domains that were specified as being the most important to age friendliness by the World Health Organization. Contents were coded to determine what older adults reported as positive or problematic features of these 8 domains, as well as facilitators, barriers, and suggestions for change. In the graph, the purple bar represents areas where participants were satisfied. Then the green bar represents participant priorities. Looking at the graph, which is ranked from most satisfied to least satisfied, the purple bar, senior residents were most satisfied with communication services and least satisfied with housing. However, looking at the green bar, which represents the priority of the older adults, housing is ranked as the greatest priority. That's over on the right. Specifically, residents wanted housing supports in order to continue to live independently in the community, and that was ranked as the most important to older adults. So our answer to address these housing and health support needs was a modified version of the Village movement. We called it Village Interdependent Collaboratives. These were based out of senior centers and were volunteer-driven with no dues to participants. Volunteers and community groups provided low-cost support and services to help people age in place. The model was doing well, so the Commission thought, let's try a similar volunteer model in high-rise buildings with building residents. We wanted to encourage buildings to be dementia-friendly and thought it should start with the building staff receiving training to recognize signs of dementia. We envisioned bringing community resources to the apartment buildings and called these vertical independent villages. So the Age-Friendly Commission realized that they had similar goals between our committee and the Dementia Friendly Illinois group. The University of Illinois at Chicago, the Geriatric Workforce Enhancement Program called Engage Illinois, had been involved with the Dementia Friendly Illinois initiative and came to the Age-Friendly Chicago Commission with the idea and the curriculum to train apartment managers on how to recognize Alzheimer's and other dementias in the residents. We partnered with the Apartment Building Owner Management Association and the Buehler Center on Health Policy and Economics, again, at Northwestern University, as well as UIC, to submit the grant for the ADPI funding. The goals and objectives for the Alzheimer's Disease Program Initiative grant was to train building managers to support persons living with Alzheimer's disease and related disorders, to identify Chicago residents living with Alzheimer's disease or living with intellectual and developmental disabilities in apartment buildings, and connect them to supportive services through our 311 system, enabling older adults to live in their homes longer and provide smoother transition into long-term care if that's what they needed. And we also wanted to train caregivers of the people who are living with Alzheimer's, and we were going to use the Savvy Caregiver program. And then lastly, we wanted to offer brain health training to residents in apartment buildings. So with our partners, we split our responsibilities. As mentioned earlier, the University of Illinois at Chicago, GWEP, Engage Illinois, developed the curriculum for building managers and staff. They did much of the heavy lifting for the apartment manager training by handling the participant registration, conducting the training, designing the training evaluation and collecting the data. Additionally, they put the curriculum into a self-directed learning module that will be available online 24/7 later in the spring. They also host the biweekly meeting of the ADPI team, and we're very grateful to Dr. Valerie Gruss and Dr. Mamouna Hasnain and their team of graduate students for working on this project. The Chicago Department of Family and Support Services really focused on marketing the training program. We advised on changes to the curriculum, especially when we had to go to the online webinar approach because of COVID, and we selected the target audience. For the evaluation component of the project, we tracked 311 referrals from properties that were trained and followed up with the managers to see if they were using the information that they learned in their training, and we called it the implementation survey. We continued to support apartment managers through email correspondences on services and opportunities for their residents. Our other partners, Northwestern, they designed the evaluation, the overall evaluation plan for the grant and managed the data on referrals from the 311 system. They received aggregate data from UIC and designed the implementation survey for follow-up with the apartment managers. Additionally, they write the evaluation reports. The the Apartment Building Owners Management Association, or ABOMA, also advised on the curriculum and program logistics, as well as reaching out to building managers. They hosted the pilot trainings that were held in person before COVID, and they've also been a really big help with marketing the program to their member agencies. So for the first year, the training was offered to ABOMA member agencies and involved many high-rise condominiums along the lakefront here in Chicago. To balance the demographics of participant agencies in the second year of the grant, we focused on training apartment managers from the Chicago Housing Authority properties and other HUD-related or supported buildings. In year 3, we wanted to target fair market apartments, and we partnered with the Institute for Real Estate Management, their Chicago chapter, to get the word out about the training. Overall, 352 people attended the training. However, some people attended more than once. So if you just looked at the attendance and added that all up, it would be more than 352, but we're talking about unique individuals. The people that were trained represented 182 apartment complexes in the city. And the table here shows the breakdown on whether buildings were owner-occupied, like condos, or fair market rental, or subsidized housing. And the right-hand column shows the number of apartment units in those buildings. So overall, the number of individual apartments that are covered by trained managers is 38,746. So we have the ability to basically have eyes and ears on over 38,000 apartment buildings to make sure that people know about services and are receiving help. Okay, so moving forward, we intend to continue some of the activities we've already started. For example, since December 2020, we've worked with building managers to keep managers and residents informed about senior service programs and other city services such as the vaccination services that they can receive from the Chicago Department of Public Health, as well as DFSS and a rental assistance program. Also, DFS does that, as well as the Chicago Department on Housing. Since September 2021, we've offered an online brain health series to apartment managers and suggested group viewing in their building, and we've provided building managers with a catalog of virtual senior center activities that they can share with the residents and connect the residents to meaningful activities. All of these activities we can expect to continue moving forward. But our additional next steps would be to bring in the spring of 2022 the dementia-friendly building training available 24/7 online as a self-directed learning module, and that's almost ready to launch. In the fall of 2022, new programs will also be added to expand existing services and meet unmet needs. For example, we're interested in how do you reach older adults who are residing in these large senior residential communities that don't have access to social services. What can we do about that? And so there will be some new programming in that direction. And with that, I'd like to thank you and turn it over. If you have any questions, here's my contact information. Or if you have questions about the Department of Family and Support Services Senior Division, you can also contact our director, Margaret Laravier. And then these are other ways that you can connect with us at DFSS. So thank you very much.
Good afternoon. I'm Dr. Valerie Gruss, and I'm a professor at the University of Illinois at Chicago. And I'll be presenting to you today, and I'm going to be talking about the actual dementia training program that we conducted for building management staff. And this presentation is supporting persons living with dementia where they live. Dementia Education for Building Management, a Chicago model. First, I would like to acknowledge my funding agency. The Engage Illinois program is funded by HRSA grant, and as you can see right here, this is Engage Illinois in partnership with the University of Illinois at Chicago, but the HRSA is our funding agency. So the Dementia-Friendly Building Program is, as Dr. Russo was mentioning, is a collaborative partnership with the City of Chicago Age Friendly Commission and UIC's Engage Illinois. And we developed and implemented a citywide training program for building management staff. And our goal is to create age-friendly and dementia-friendly buildings throughout Chicago. Again, I'd like to acknowledge my co-director of Engage Illinois, Dr. Mamouna Hesnain. Dr. Hesnain is a professor and associate head of faculty development and research at the College of Medicine at University of Illinois in Chicago. I would like to disclose my funding right now. I am funded through HRSA, Health Resources and Services Administration. I also am a co-investigator on a CDC grant for a Healthy Brain Initiative, and I'm also funded for AWAN and an NIH grant also. And Dr. Hesnain also has multiple funding agencies, including and some book revenue. However, we have no financial conflicts of interest with the presentation today. So let's get started. As you can see on this map here, this is World Health Organization World Clock that indicates the number of persons, older adults living in the globally. Okay. All the blue area indicates countries that have a population of older adults. 10 to 15% of the population right now, or in 2015, was older adults. We do anticipate that this is increasing with the baby boomer population, and it is predicted that by 2050, 30% of the global population will be older adults. That's a huge proportion of the population. Thus, our funding came through for HRSA because HRSA has been providing grant funding for work to develop the future geriatric workforce and to create age-friendly and dementia-friendly communities. Because as we know, as the population ages, so does the incidence of dementia. So why dementia training for building management staff? Why are we doing that? Well, we know with the increasing aging population, there's an increase in the number of persons with Alzheimer's disease and related dementias, because as we age, the risk of developing a dementia increases also. So it's important to recognize and diagnose the early stages of dementia. And the reason you want to identify persons with the early stages of dementia is because we can provide assistance to the person living with dementia so that they can safely remain living in their home and age in place and continue to live where they choose. And this can be accomplished if we identify the person with memory loss or dementias, because we can provide needed services and resources to support them to continue living in their home. Thus, we identify building management staff because they're the first line contact for identifying problems with their older adults residents. Building management staff are there every day, 24/7. They're very familiar with their residents, and many times they're the first person that will identify some changes. So it was important for us to educate them to be able to identify changes of dementia. Thus, educating the building management staff through a dementia training program, we believe would create a workforce that can recognize and address the changing needs of their older residents. So our goal for the dementia training program is to provide trainees, building management staff, with the skills, resources, and tools to help their older adult residents to continue to live independently in a safe environment in which they are understood and respected. So these are the learning objectives for the dementia training that we conducted for building management staff. So it was our goals and our learning objectives were first to recognize dementia symptoms and behaviors. So in the training, we cover what is dementia, what are the symptoms, and what are the recognizable behaviors that you may encounter. Second, we discuss the effective communication strategies and support of persons living with dementia. One of the challenges that building management staff face is that they aren't familiar with a better way to communicate with their residents when they're behaving differently or when they're demonstrating behavioral symptoms of dementia. So when we cover communication strategies, we also cover things like do's and don'ts, the best way to practical information, the best way to approach someone, and things that you should not be doing because it may confuse the person, or it may it's not productive communication. So we actually do it a lot with do's and don'ts, and we do even interactive exercises. And third learning objective is to identify strategies for enhancing the communication with persons living with dementia. And one of the ways we do that with the training is that we do interactive case studies where we present a scenario, and we work in small groups, breakout groups, and then we go through the scenario, and we have the building management staff identify ways that they would respond to a resident if that was the scenario, if that was the case. And then the last learning objective is to utilize resources and tools to assist persons living with dementia to live independently in the community and to age in place, because that is the goal. And if our goal is to allow people and enable them to age in place, the way to do that is to first identify when there are issues and then provide resources and support services so they can continue to live safely and continue to live independently. So when we begin our training, our dementia training for building management staff, it's really important for us to educate the staff that they are not being asked to be counselors. We're not asking them to be social workers. And we're not even asking them to change their daily activities or their work responsibilities. But we believe that they can identify and report if they notice some changes in their residence. And then we educate them on red flags and symptoms to look out for. So once the building management staff has identified a danger sign or what they believe may be a danger sign, our protocol is that they call the City of Chicago. which has created a 311 program, a hotline, and they can ask for senior services, and they can report the changes. And once they report the changes, usually it's the Community Care Unit, CCU, Illinois Department on Aging, will send out a care coordinator who will assess the resident. And that usually can be expected to happen within 72 hours, that someone would come out and do an assessment. So again, it's the building management's role not to diagnose someone, not to be a social worker, but their role is really they know their residents so well. So their role is really to identify changes. You know, are they acting differently, or there is something different, or they forgot to pay their utility bill and it's going to be shut off, and they swear they paid it, but again, they forgot. So we go through many scenarios of situations that could happen that could be a red flag that would identify someone that may be going through changes. And then the building manager's role is to call 311 and to report the changes. When as Dr. Russo explained, when we started our dementia trainings pre-COVID, they were in-person trainings. And these in-person trainings, an example was 2019, right before COVID. In November, we trained 150 building management staff. And at that time, it was with Sudler Property Management. And you can see this, this photo here. This was done at the training. And this was done pre-COVID. And it was in person. And the training at that time, it also included didactic content, and it included interactive group work. And then again, the content included, going over what is dementia, what are the dementias, how do they present, what are the warning signs of dementia, again, and how do you approach someone who may have, who's living with dementia, how do you communicate effectively, and then we also discuss safety issues, and some related to such as when residents wander, or we provide resources or tools for them. And then again, we have the interactive sessions. So the in-person training that we did here in November 2019 with the 150 building management staff, when we talked to the administrators from Sudler, they told us that although we trained 150 people that day, those 150 building management staff interact with 30,000 older adult residents because they're in so many different buildings. And so that just demonstrates the impact of working with building management staff and training them, and the impact it could have on enormous numbers of older adults in Chicago. So again, the in-person training was a 90-minute training with didactic content, interactive group work. We go over what is dementia, the approaches to use when a person has dementia, the do's and the don'ts, managing challenging behaviors. We do have some scenarios where we have residents that have some challenging behaviors, whether they're aggressive behaviors or changing in behaviors. And then we do talk about safety issues. And then we go over the different resources and tools that are available to them. At the end of the training, all the participants who participated in the training session do receive a certificate of completion, and they receive that after they've participated in the training module and also completed our surveys. As far as data collection and what we've obtained from all the building management staff, we do a pre and a post-training survey. So these are completed. The pre is done obviously before the intervention, before the training, and then post-training survey is done immediately after. However, we do follow up 3 months later. So 3 months later, after they've gone back to their facilities and they've reflected on the training, we do survey them to see what has changed. Has this changed your role? Has this changed your practice? And in what ways? So we do gather that information. And then, as you know, COVID-19 hit. So due to COVID-19, we had to reconfigure our programming. We had to change from an in-person training to something different. So immediately in 2020, we had to cancel our spring 2020 and summer 2020 in-person dementia training sessions. We held regular meetings with Dr. Russo and the City of Chicago team, and we had strategic planning meetings, and we redesigned the Dementia Training Program to be a virtual workshop. Here we go. Okay, so we created online webinars, and we developed and implemented these online webinars. And as you can see here, we had over 100 persons participate in November. We held an online virtual webinar in February. We had one in May, and we had one the following November. The webinars, as far as the training itself, really was we used the in-person training, and we actually created an online webinar that we used, but the format and the content remained the same. And then for the interactive case studies that we were doing, we used Zoom, so we were able to do breakout sessions and do interactive case studies with groups of people during the Zoom webinar trainings. So some of the challenges with going to these webinars, transitioning to webinar trainings. What we found was initially we had more people who registered than actually attended. So when that happened, we worked together, our team and the City of Chicago team, and we strategized and we decided to send out more reminders. And we were able to also capture people who were sharing computers, because if only one person was on the computer, we had their name only, and we didn't know how many people were attending using this, sharing computers. We also added relevant content on COVID-19. We looked at this as an opportunity. We were doing the dementia training, but we also felt this is an opportunity for us to train and educate building management staff about COVID-19 and older adults. So we added relevant content on COVID-19. And we educated them that persons with dementia, they may not understand why everyone is wearing masks, or they may not be able to socially distance. And so, again, how do you approach that? How do you gently remind someone? And perhaps they don't have the capacity to really understand why that's happening. So we covered COVID-19 and then the person with dementia also. We added COVID-19 resources. The City of Chicago had citywide COVID-19 testing sites available. We were able to provide links for the building management staff. There's a Chicago vaccine finder that was available. The city did a great job. So we were able to provide links for the vaccine so that the building management staff, it would help for the staff and for older residents living in their buildings. And then we had to extend our webinars. We had to extend it to 2 hours for all the online activities, because the breakout sessions took longer because some people weren't familiar with Zoom. So we had a little technology challenge there. So we had to extend the webinars a bit. So we did extend it to 2 hours. And then we also added another case study too. So our this is May 2021 dementia training. Again, it was 2 hours of training, and we had registration and we had multiple reminders, and how we strategized about the challenge of people sharing computers, and that we had everybody enter their names in chat box when they entered the webinar, so we were able to get the registration, an accurate registration. And again, because we were surveying them, and then also we had a 3-month survey, so we had to make sure that we had everyone's names. And then we also had to increase our staff doing the training, because we had to have facilitators for each breakout session. So let me give you some information about the surveys and that data that we collected and what was the impact of the dementia training. So residents with dementia and building management, we actually measured staff preparedness. So as you can see from the image on the left, the survey item was caring for residents with dementia is a serious problem. So we wanted to know, do building management staff believe that this is a problem in their facility? And 84% of the building management staff strongly agreed or agreed that this was a serious problem among their residents in their building. And on the right here, we have the existing building management team at my building is adequately trained to assist older residents with dementia. And again, here we had over 26% strongly disagreed that they're not adequately trained to handle older adult residents in their building that may be having dementia symptoms. And then we measured the impact of the dementia training itself. So as you can see in the image on the left, knowledge about dementia, we measured them before and after the training. What was their knowledge about dementia before the training, and then how did it change, and what was it like after the training? So as you can see from this bar graph with the blue and the red on the left, that knowledge before the training was 60% felt knowledgeable or very knowledgeable about dementia. And then after the training, that went up to 84.8% of the building management staff felt that they were knowledgeable about dementia. And we also measured building management staff about what is their preparedness? How prepared do they feel to communicate effectively with residents who have dementia? And again, communication is such a key component of working with someone who's experiencing dementia. So we do a lot in the training on correct communication. Okay. And so here we actually surveyed the building management staff about how prepared do you feel to communicate effectively with the residents. And as you can see here, it was the green is the after, and you can see it increased quite a bit, that they're prepared, how prepared they felt, that they were able to effectively communicate with their residents with dementia, and that increased significantly. Okay, so here again, this is we measured the impact of the dementia training all along. Even when we started with the in-person training, we transitioned to the virtual webinar type of training. It was important for us to constantly refine the program. Identify challenges with implementing the program or with the program itself, and continuously refine the program. And here, when we surveyed the building management staff about the impact of the dementia training, on the left, you can see it's, now that I have gone through this training, I'm confident in my ability to refer residents who might have dementia to the city for services. And this increased to 92%, strongly agreed that their confidence increased, and that they felt confident that they would be able to implement the recommendations of the Dementia Training Program. And then on the right, we did survey them. It is important for me to help link residents who might have dementia with appropriate services. And again, this is 95% strongly agree that they understood now. It was important for them to link the residents with possible dementia to appropriate services. And then they also knew what that looked like, that they would be calling the City of Chicago 311, and someone would come out and assess the resident. And then we did ask about the training itself. So we asked residents to rate the training in general, how they felt about the training. And what we found was that 51.9% rated it as excellent and 43.5% as good. So again, we're really high there. We're into 95% are say that the training was very effective. And then the usefulness. And again, this was very important for us because we wanted to know if the building management staff viewed the training, is this something practical and useful that you will actually use? We were surveying them 3 months later to monitor if there were changes and how did you implement what you learned. But this is initially after the training. Did they find it useful? We asked the respondents if the training provided information and skills that they could use on their job. And 98% found that the dementia training was useful. So for the future dementia training for building management staff, you can see our journey here. We started with the in-person dementia training, and that was very successful. We connected with all different building management staff throughout Chicago, engaging with thousands of older adult residents. And then COVID, it caused us to change the way we were providing the training. And we found that that was very successful. And we were able to actually, with the virtual webinars, we were able to not only provide the dementia training, but then also provide information about COVID-19 and resources that are available to their older adult residents. And as Dr. Russo mentioned, our next phase, our new phase that's getting ready to launch, and we anticipate it will be launched within the next month or so, is an online virtual training module, and it'll be on a dedicated website. And the dedicated website will offer the flexibility and the convenience for any building management staff to go into the website and take the online training module. And they just register and they take the module. The advantage there is they can go in at their convenience, they can go in whenever they have time, they can start the training and come back to the training if they can't complete it within one sitting. They can also do a refresher. So building management staff that may have had the training before and would like a refresher on some of the information can go in and take it again. And then here, the advantage of having the virtual training webinar available is that a lot of the buildings where we did train already, the building management staff, they do have a lot of transition in their staff, or they have new people that come on. So for the new person, if we've already trained the building, they might not be available, or they haven't had the opportunity to do the in-person training. If we have this online module, they will be able to go in and take the training themselves. So all of their colleagues at work have taken the training. They're a new employee and they didn't receive it yet, but they'll be able to go into that online module and take the training at their convenience. So we'll be able to offer it to all new employees too. So to summarize, we're creating dementia-friendly buildings by implementing a dementia training program for the building management staff that produced a workforce confident in addressing the changing healthcare needs of their older adult residents. We've been able to address the challenges posed by COVID-19 by successfully transitioning our in-person dementia training to online webinar trainings. And we are now moving to an online virtual training module on a dedicated website to provide convenient and flexible access of all our training materials for building management staff. Thank you very much.
Thank you so much, both of you, for your excellent presentations. We're going to move to questions in just a few minutes. Please start to enter questions you have into the question pod. Dr. Gruss and Dr. Hussain's information is right here. And before we move to questions, Erin Long is just going to say a few words about the funding opportunity announcement that is open for applications. Erin?
Hi, everyone. First, I want to thank our speakers. What great information you provided. We really appreciate it. We're very proud to have been able to fund this great work and so support the people of Chicago. I just wanted to take a second to address this slide that you see in front of you is just some brief information about a funding opportunity that we have open at the moment. It is the same funding opportunity program that the city of Chicago has benefited from to propose and implement this education program. We have pretty specific requirements under the grant, but if you see the link there, you can go to grants.gov and search on ADPI. We held a informational call a couple weeks ago. There's information on how you can access the recording of the informational call to learn about the grant and the opportunity. Again, due May 24th for applications, and I hope those of you that are eligible community-based organizations or state organizations will take a look and consider applying. And with that, I'll go back to you, Sari. Thank you.
Thanks so much, Erin. So we do have some questions that are populating here. There's a few questions coming in about the applicability of the online modules you were talking about to other areas. Would those be appropriate for building managers in areas outside the city of Chicago, or would some adaptations need to be made? Can you talk a little bit about that?
Hi, this is Dr. Gruss. The training itself is applicable to other building management staff, or it could be other types of facilities even where residents, maybe some SLIFs, we have supportive living facilities in Illinois, where there's someone overseeing the residents and it's residential housing. And so I see it as applicable, the part of the training that we do about what is dementia, how do you communicate, what are some strategies we can use, and how do we handle challenging behavior of someone living with dementia. All of that is applicable to everyone. What's unique about our program is that with the City of Chicago, they created the infrastructure for the building management staff to call in. And it's very simple. They can call 311 Senior Services, and they created this mechanism where that call is taken. And then what happens is that someone will come out to assess that older adult resident to see, what is going on, what kind of services can we put in place to allow them to continue to live independently and safely in their community. So that piece of it is unique to Chicago. Dr. Russo?
Right. The people who attend the training, if they're from outside the Chicago area, would need to be able to think of their own area agency on aging as the main contact for that. So I think the video would be very appropriate, especially the communication and behavior techniques. But if somebody was watching it from outside the community and did call Chicago, we would then refer them to the area agency on aging in their district or state.
Great, thank you so much. Dr. Russo, the next question is for you. As you've worked in the city and have heard any feedback from 311, were there any instances where residents of the buildings were frustrated or upset or disappointed that a manager would call 311 on their behalf to try and get services, or has that been relatively smooth?
For the most part, it's been relatively smooth.
Oh, sorry. Go ahead.
Well, I was saying, for the most part, it's been relatively smooth. People appreciated just a call to check in and see how they were doing. They do have the ability to refuse services if they want, but we do work with the apartment managers as much as possible to give them resources that they may be able to use. And I find that most of the apartment managers are thankful that there is somebody else that can step in and assist. They really appreciated when we sent them information to share with residents about a rental assistance program or where the vaccines were being distributed in their local area. For the residents, when they get the call, some of them might say, oh, they don't need it, but we do have trained phone people that are really good at encouraging and taking the perspective, this is helpful and why don't you just try and see. So I think overall it's been very successful.
Great, thank you so much. Dr. Gross, anything you want to add?
Yeah, I would like to add something. When we were doing the training, one of the things that was so impressive was the building manager commitment to their residents. They're so committed to their residents. So many of them would come up and say, thank you so much, because I care for my residents and I didn't know what to do. I know a few of them were acting differently. I didn't know what to do. I didn't want to send them to the hospital, but what do I do? And now you've given me the tools that I need. And because of their connectedness with their residents, many times when they would tell the residents, I think I'm going to have someone come out and, to talk to you because I noticed this. If they have this trusted relationship already, many times the older adult is willing to cooperate. And they're really okay with it because they have this established trust relationship with their building manager, because they're there, again, day in, day out, 24/7. They really know their residents and they really care about them. So because of that relationship, it usually goes very well. Mm-hmm.
Great. Thank you so much for adding that information. It's nice to hear the anecdotal pieces of information where people come up and tell you, give you such high praise for what they've learned. So another question came in asking if either of you have done any work to determine if the training has helped lessen the move from independent living to assisted living or other types of more supportive living situations, or if you plan to do that kind of assessment at some time in the future.
Right now we're looking to get more of the accounts from the apartment managers on how they've used the training. So we're still doing the data collection on that to ask how many referrals have they made since they've been trained, and has it created any changes within the apartment building to smooth things over and make your day-to-day communication with residents easier. But we haven't specifically asked about the transition to assisted living or any other facility. The plan for moving forward is to look at other services in buildings, and that may be a good aspect to measure moving forward as to is it helping people stay in their home longer, and is it making it easier for them to plan to move to the next step. So I do like that suggestion.
Mm-hmm.
Great, thank you so much. And Dr. Gross, anything you want to add about that?
Just briefly, we don't have data on, is this actually having an impact on, there's fewer transitions to long-term care? How much longer does this enable them to age in place and live independently? That's our goal, is for people to be able to choose where they want to live. And I believe they can age in place as long as they have supportive services that create a safe environment in the home. And so that's our goal. And so, but we don't know we really don't have data on, is this actually preventing people from being institutionalized or sent to long-term care? But that's our goal. That's really what we're trying for.
Great, thank you so much. Very helpful. Do either of you have any other comments you want to add? It looks like we have reached the end of the questions that have come in. Dr. Russ or Dr. Russo, anything else you want to add before we close out?
Yes, I did want to say that the training is not just for building managers, but we do encourage building staff, whether they're the engineers in the building or the door people, but the ones that interact with residents on a regular basis would benefit from this, not just the building managers.
Mm-hmm. Yeah.
That's great. Anything else, Dr. Gruss, that you want to add?
Now I want to thank the City of Chicago and Dr. Russo. This program is so valuable, and the impact that we're having, it's so rewarding, because I think it is such a positive program, and I think we really are enabling older adults to continue to live independently in the community, and they're living in the homes that they want to be in. You know, these are their homes, and sometimes it's just a matter of them needing some types of services, you know, whether it's someone doing their money management so they can pay their utility bills on time and not forget, or doing some other services. These services are available. We just have to find out where the need is and implement different services. So thank you to the City of Chicago and to Dr. Russo and her team. And yeah, we're going to continue to move forward and continue to refine and improve the program.
Great. Well, I do want to thank you both so much. Were you going to say something?
Oh, no, just that. Thank you, Sari, for the opportunity to share this information. And also Dr. Gruss has been so instrumental in getting this out to all of the seniors. So thank you.
Well, it's a very unique program, and we thank you both for sharing it with us today at our National Alzheimer's and Dementia Resource Center webinar. We'd like all of you to join us for our next webinar in the series, which will be May 25th, 2022, to focus on the Wisconsin Dementia Care Specialist Program, which has been a statewide effort to support people living with dementia, their family caregivers, and their communities. So we hope to see you there. Registration information is on the ASA website. I will turn it back to Julia for some final remarks.
Great, thank you. Just as a reminder, if you would like to claim CEUs for today's webinar, you will be receiving a follow-up email in about an hour or two that has the link to the CEU application. You have 60 days to apply for those CEUs, and then it may take up to 30 days for us to process and issue those to you. If you have any questions, please feel reach out to our team here at ASA. You can always look for more webinars on our website at asaaging.org. And I would just like, again, say thank you to Dr. Gruss and Dr. Russo and our partners at the NADRC. We are so appreciative of the teamwork and the information that you share. So we will sign off now and wish you all the best of the rest of your day. Take care.
Thank you.